incredible, actually, because it's kind of a funny situation in the sense that a lot of times foundations or organizations are named after someone who has passed away. And so it's an ongoing, I don't want to call it a joke, but it is an ongoing situation where when I'm introduced or people say I'm going to be there, first of all, they're like, she's alive. And so it just gives me, I'm just so honored to be here because I see what we're doing and I see how people are being affected by it. Because had I passed and Vince and Terry started this without me being here, you know, I'm sure I would know, but not see it firsthand, and also be able to be a part of it. So it's just, it's overwhelming. One thing about having metastatic breast cancer is not many people talk about it. And 11 years ago, when I got diagnosed with breast cancer, it was discussed, but not like it is today. But I was still very open about it. Women didn't want to talk about it, which I understand and I respect. But we're never going to move forward if someone doesn't stand up and discuss it or show what the disease can do or show the positive sides of it. So when I was diagnosed with metastatic breast cancer, it was really upsetting that I could not find that much information. There are no support groups for metastatic breast cancer survivors. It's almost as though society wants to just say, okay, you got it, and good luck, and who knows how long you're going to live, because it's not a good prognosis, but it can be a good prognosis. The medicines now that have come out since I've been sick 7 years ago have advanced. Research is being done on metastatic breast cancer more so now than it ever has. So I feel like I'm almost like I'm obligated to be a spokesperson for it, that hey, look, you can live a normal life. I was told that it will be like living with HIV or heart disease. It just means that I'll always be on some type of medication. And so yeah, I got to work a little harder at it, but I'm still here. Well, the Cure package was created when I got sick the first time. And I had studied photography in college, and my aspirations actually were to be a fashion photographer. And when I first got sick and lost my hair, I had started to go to a couple support groups because, you know, the doctors thought it might be a good idea and what have you. And so I was 29 years old, and I go to the support groups. And some of the women there are much, much older than I. And the focus of it was not so much the disease, but not having hair. And I just didn't get it. I didn't understand it. It's like, not that I was scared, but it's like, listen, we got more things to be more concerned about, and not our hair. Our hair is going to grow back. Our lives may not. So I put the two together with photography and thought, well, this would be a great opportunity to photograph myself bald. And I didn't even think about creating an exhibit. So as the disease progressed, meaning I had to have a mastectomy, I said, well, let's go. And another reason why I did the pictures with the mastectomy is when I was shown the photographs of what I could possibly look like, or women, again, from support groups were so fearful of losing their breasts that they thought that they wouldn't be a woman anymore, or I can't have my breasts removed, but I'll die instead. So again, it was like a vanity issue. And I said, well, I guess I got to make that stand. So I feel as though I called it the Cure package because I feel that it is a stepping stone to understanding the disease and getting through it. And also, I show and discuss sexuality, which I think is so important for women, because when you're handed this little book that says chemotherapy and you, they don't discuss that, and there's no reason that just because you're going through treatment or you do lose a breast that you're lesser of a woman. So I feel that it encompasses everything, and I just hope that it is reaching people. The cookbook was brought to us, the idea came from Dr. Wolf. We were looking for some type of fundraising event, not so much an event, but a means of trying to raise money annually instead of on different occasions or different events. And so Dr. Wolf was able to come up with this wonderful idea. She saw it at another event. You know, she sees the importance of it because she had a patient who needed a mammogram. She heard about the foundation. She sent her patient through the foundation and found out that we had run out of funds because we've just been screening so many people. And she's like, no, we got to do something about this. And then she approached us with the idea. So almost 3 months after it was printed, we have raised almost $30,000 because of it. I can't say enough about the people and the staff of Broward Health, and especially Coral Springs Medical Center, because if it wasn't for the staff at Community Ed and what have you, none of this really would come into fruition. The cookbooks, we never thought the amount of cookbook sales would be what they are, which means someone behind the scene is responsible for that. So not only the support from the hospital, but you could see in everyone's eyes that they care, and that's why I always say the cookbook has become a labor of love, because it's not just about selling the cookbook and providing mammograms, but the people that are behind the scenes selling it and putting it together are just as excited as we are. So it's been a wonderful event, and just really looking forward to actually growing the organization to a larger amount of people being able to be screened. But we don't want to say, okay, here's your mammogram and oh yes, you have breast cancer. So through the efforts of the hospital and Dr. Schachner and everyone else involved with the foundation, it was very important that we made sure that these women are looked after.